Okay, are now in a webinar for the Physical Therapy Assistant Program. Um, we're going to try to show how to use an assessment tool for physical therapy assistant clinical instructors, also called CIs. With me today, and I'll say who I am in just one second, is Tammy Marson. And this is Tammy. Tammy, can you introduce yourself?
Yes, I hope everybody's doing well. I'm the academical clinical coordinator for the education part for Horry Georgetown Technical College. My role is to be the link between the academic institution and the clinical institution, and so we very appreciate our clinical instructors and all they do for our students.
All right, great. And I'm Sean Glassberg. My picture's right here. I'm the Director of Faculty Development at Horry Georgetown Technical College, and I try to work with both adjunct instructors and new faculty who are brand new to the institution and try to help them better orient themselves to the college. Today I will be playing the role of a clinical instructor who is new to the PTA program at Horry Georgetown Technical College. Tammy is, as she noted, is responsible for being the link between CIs and the academic part of the institution for the physical therapy program. She will be the leader of this webinar. I will be the clinical instructor trying to figure out exactly what this assessment tool is supposed to do for me and for the students. So Tammy, if I'm new, I'm brand new. We're sitting down, except this time you're in your office at Myrtle Beach. I'm here in Georgetown, and you're trying to basically teach me why we should be using this tool and how to use it.
Great. Thanks, Sean. Well, first of all, 30 days before your students will appear for their clinical affiliation, the clinical instructor will receive this assessment tool in the mail along with a copy of the syllabus. This particular clinical assessment tool is utilized for their 4-week rotations, which is their first 2 rotations. This assessment tool can be used in any setting, whether that's outpatient, acute care, rehab, or home health. It was designed for those purposes.
So basically, I'm a clinical instructor, but I'm also a practicing physical therapist.
That's or assistant, yes.
Or assistant, and I've got this student with me who's going to be shadowing me, and then also, I guess, executing some of the things that they should be able to do upon graduation or wherever they are in the course, the program.
That's correct. We want to make sure that when they graduate that they're ready to, then they not only have academic knowledge, but they can also start to function in a clinical setting. And that's the role of the clinical instructor, is to help us assist that the academic knowledge that they have is being able to be executed.
Okay, so I have a pretty important role as a CI. Okay.
Very much so.
And I'm looking here at the, just to be sure, I'm looking at the 230 Physical Therapy Assistant Program. The course number is 234. Right?
That's correct.
Okay.
Yep.
The 253, we'll go over the difference between those later, but they're a little bit different, these two different forms. Okay, so we have an agenda too, Tammy, that we'd like to follow here, and I'll go ahead and look at that. A few different things. We might do a little bit more depending on the time that we have. But we're going to review the assessment tool overall. We're going to talk a little bit about the purpose of the educational methodology assessment tool and what is the difference between summative feedback and formative feedback. So I think actually you already kind of, well, maybe we can say a little bit more about this particular assessment tool. I know that my job as a CI is to complement what you're doing in the classroom by making sure that the student can then apply what they've learned in the field. And so this assessment tool I'm using, I imagine, to grade them. Is that correct?
That's correct. It is used to grade and to give them a summary of how they're doing at the clinical, at midterm, and final.
Okay. And that's what you meant. So I guess summary means summative, right? Is that what you're?
Yes.
Okay.
Yep.
So tell me about the importance of giving the summary feedback or summative feedback.
Well, it's very important. Clinical instructors are great about giving ongoing feedback, like how the student is doing, with one particular treatment, or how they're doing as they, at the doing a specific technique, but the summative feedback is excellent because it puts it all together. It tells them overall where their strengths and weaknesses are, and that way, by doing this at midterm and final, it ensures the students that can do any type of corrective behavior or any increasing clinical skills for their final, they're going to know overall where they're at.
You know, when I think of summary, I think of writing. And for some reason, I think of, okay, I have to write a paragraph. But it doesn't look like that is what I do within this form. It looks like I use some sort of scoring system here.
You're correct.
And that's the 4, 3, 2, 1.
You actually do a little bit of both, Sean.
Okay.
You score the individual type of task. So, like, if you could just pick one on one of the pages there, like maybe something under, if you go down to the bottom, maybe where we can see the key a little bit, like maybe where it says I performs passive range of motion under, that's fine.
So
just stay right there.
Right, this is the key you're referring to, right? Okay.
Yeah, and if you see number 29, like there it says perform soft tissue mobilization, that's kind of an overall. It is a specific technique, but it's not saying that they can perform soft tissue mobilization on an upper extremity or a lower extremity. So it is giving a summary of how they're performing that particular skill overall.
Okay.
Which is important to know, because if not, that's something that they need to spend some more clinical time or academic time either gaining the knowledge or spending more time practicing the specific skill. So that is a summative in that it gives an overall of how they're doing in a specific task. Okay.
So let me go back up here. So the midterm and the final, right? So we have the two what are these called? Again, columns, thanks. It just escaped me.
It's
So
okay.
these two columns, one is midterm, one's final, and I'm going to give either 1, 2, 3, or 4 in each one. So I'm not doing this after each time they work with me. I'm only doing it twice during the 4 weeks.
That's correct.
Okay. Now, are you, if I'm a physical therapist or a physical therapy assistant, I'm a pretty busy person. I've got a lot of patients. Are you going to remind me when the midterm is, or do I have that? How do I know when it is?
When we send out the packet with this assessment tool in there, there's a letter in there stating that when the midterm is due by. I don't require the midterm to be sent back to me here at the school, mostly because we're doing site visits, and we will either call it midterm or we'll come visit the student. We try to visit every student on every affiliation, but sometimes by location or schedule it's not feasible, but we do at least talk to the clinical instructor. We ask the clinical instructors that if they feel that there's any chance of them failing the affiliation when they can see where their scores are at midterm, then they send the midterm into the academic institution and make a phone call to me, letting me know where the areas of deficits are. If not, we'll definitely be touching base with the clinical instructor at midterm.
Okay. All right. So, all right. I get the. Let's go over this 4, 3, 2, 1. I'm not really. I want to, as a clinical instructor, I think it's important for me to get a real good feel for what these different point systems mean. Now, I know they have to have a 3 or better, correct?
As an overall, their overall score has to be a 3 or better, and we can look at how we get that overall score when we get down to the end of this assessment tool.
Okay, let's do that then. Yeah.
Yeah, their overall score has to be a 3 or better. There are some things that they have to have a 4 on, but let's look at the key first and describe each one of these, and then we can talk about the ones that they have to have a 4 on.
Okay.
The 4 is that they only need confirmation from a clinical instructor. And so a great example of this is that if you had a student and your goal for them was to be able to progress a patient's exercise program, what you would want the student to do is come up with a program, and then you review it as a clinical instructor and say, yes, that's appropriate. They're not doing it independently, but they're only needing you to tell them that, yes, everything is correct that you've done, and you agree with it. Then you would give the student a 4. If they need intermittent guidance, it means that they need just a little bit of nudge in order to complete the task. Like you can say, yes, that is a good progressive home exercise program, but did you also consider that you needed to strengthen not only the gluteal medius, but you also need to strengthen the gluteal maximus? And then they could tell you exercises to do for that.
Okay,
so there's just a little nudge.
Okay, so it's kind of like a student, you know, as a physical therapy or physical therapist or a physical therapy assistant, I know the patient way better than the student does, so I kind of have an idea of what the patient might need already.
Definitely,
Okay,
yes,
okay,
yes.
okay.
Yes, yeah, and you know, a clinical instructor, a clinician's going to be able to just to do that on the spot. A student may need some time to go away and come up with that or to prepare for the next session.
Okay.
But the instructor, the difference between a 3 and a 4 is that in a 4, an instructor should just be able to say, yes, you've covered everything that I would have covered.
Hmm.
A 3 is that the instructor had to say, you know what, this is good, 75% good,
Hmm.
but you're missing one little piece here. And
Hmm.
then they give the student the nudge, and the student's able to come up with that. A 2 is where the clinical instructor really has to guide the student a lot more, that they really have to say, what muscles do you need to strengthen? And then they would say, okay, well, we need the patient to gain hip extension. What muscle does hip extension? You
Oh,
know,
wow.
and so they have to give them a little bit more, and the student could say, oh, I know gluteal maximus does hip extension, and then they may say, okay, come up with an exercise for hip extension now. And so there's just a lot more that they have to pull the information out of them a lot more. They have to help the student critically think the difference
Okay.
versus then them just naturally coming up with it. And a 1 in reality is the student cannot pull the information out. If the clinical instructor would say, hey, tell me what muscle does hip extension, and they have no idea, that would be a 1 for us at that point in time.
Okay.
Yeah.
And also, like, I'm looking here, and again, you know, everybody knows now I'm playing the role of a physical therapy assistant instructor. I'm not a physical therapist. Some of these also are physical, like, you know, with a 4, I imagine that, you know, if you're an instructor, CI, a 4 means that you feel comfortable enough to leave the student with the patient and not even be able to see what the student's doing. Because
Well, we would
I
always, with
see here.
students, we're always in direct line of sight of supervision. We have to be legally.
But okay, so the student, but when I read this, the student is capable of functioning safely without the CI in direct line of supervision. What does that mean?
Um, I guess the reality, I'm sorry I couldn't see it all the way over on the screen. The student, the CI, if they stepped on the outside of the door, then that would be acceptable.
Okay.
Like if they are, you know, they're in the area, they're on the outside of the door.
Okay. Okay.
Yeah.
All right. I just want to be clear about that.
Sure.
All right. Student requires input. Okay, great. All right, good, good. I feel like I have a really good understanding of how these points are given. You mentioned before that there are certain categories where the 4 has to, where the student has to be able to earn a 4. Did you want to share those with us?
Yeah, because down there you'll see at the very bottom of this key, the single star states where, I'm sorry, Sean, just go right back up to where you were.
Okay.
Yeah, the single star says designated safety criteria elements. The student must receive a 4 to pass these. These are items that would put the patient at risk safety if they were not performed. So example, I believe it's on page 2. One of those says that the student needs to be able to review the plan of care.
Right here.
Yeah, the plan of care tells us what the physical therapist has stated that that patient needs to be doing or what that patient can't do. And if, for an example, if we had a student who came in and did not review the plan of care and performed ultrasound and the physical therapist never marked it on the plan of care, and that particular machine could be contraindicated to that patient's medical condition.
Wow.
And so really a 4 means that they are taking the safety ones. What we have said is those are safety things that could put the patient at harm. Okay?
Yeah.
And the student has to have a 4 on those. The other one, double asterisk, which I believe, Sean, is on the second to last page. I think you'll see some examples of that. I apologize, we just kind of have to flip through, but
Cool,
there
good.
are the ones that are double asterisks. What those are behavior, and these are the these particular items are found in the guide to practice as a physical therapy assistant, and what type of behaviors that they should have. These should be somewhat built into them, that they're accountable as far as showing up to work on time. When we take on a plan of care to treat a patient, we're stating that we are going to be able to provide that level of assistance. And if they're not showing up to work on time, then that would tell us that they're not accountable. And that would then warrant termination from the program, because we have to be able to be accountable to our patients in order to meet the goals that the physical therapist has established for them. So
Do
it's
we,
almost like we're taking on a contract with them.
let me ask you a question. Do we have students that don't earn fours on these?
We have a few. It does come up every once in a while. Hopefully we've taken care of some of these issues on the academic side before, but sometimes it doesn't. We have had one or two students that have demonstrated this behavior is not appropriate. It's far and few in between. So I don't want people walking away from this webinar thinking that we're going to send students out that have issues with this, but every once in a while it does happen that people can behave as well as they want to when mom and dad's around, when us clinical academic people are around, and when they get outside of our eyesight sometimes they may regress to behaviors that we're not aware of.
Okay.
Yeah.
All right. Because I know when I look at it, I'm thinking, as a student, it maybe is how do you exhibit compassion, caring, and empathy? What's the difference between a 3 and a 4? Does that make sense?
Yeah. Empathy is, let me give you an example. Let's say that a patient came in and they had a diagnosis of right shoulder pain, and they've also had a history of breast cancer, and maybe that's the reason why they have shoulder pain at that point in time. And let's say that the patient has just found out that now their breast cancer has metastasized to their spine, and the patient is very emotional about it. The therapist should be able to continue to provide care to that patient, but do it in a caring manner that that patient feels as if they're being supported, and maybe just not like, oh well, sorry this happened to you, let's move on now because I got 3 more patients to see today.
Okay. Doesn't try to rush through.
Yeah, and not only rush through it, but they should be able to say as a clinician, wow, I'm so sorry that this has happened to you. In your shoulder is probably, we probably still need to address these deficits in your shoulder. Do you feel like doing this today? Do you need some time? Do we need to reschedule? Okay. It's very important, though, that you continue to do your home exercise program.
Okay. All right. So I see where you're going. It's kind of like going a little bit farther than just being there for the actual physical therapy, and you not necessarily have to be a counselor, but to at least consider that someone might not be up to the challenges that they might meet in physical therapy. And I understand. Okay, great. All right, good deal. Okay, so all right, it's like I'm getting a pretty good understanding here. Let's look back at our agenda, though. We have gone over the grading key. Is that correct?
That's
sure,
right.
We talked about summative feedback is something that isn't necessarily a summary in paragraph form, but just summative feedback and I think it depends on when you're giving it, right? Midterm?
Yeah, that's right.
Go ahead.
Yeah, midterm and final. We give formative feedback all day long, how they are doing with individual tasks or an individual patient. But the summative feedback is supposed to mean overall how they're doing. And this clinical instrument is using a key to give that feedback. It really saves the clinical instructor some writing time because the key is defined, and they can use that as saying how they're specifically doing in task.
Okay. Great. Thanks for clarifying that. I've got another question for you that actually we didn't even talk about before we started this webinar, but I think it's something that you might want to review with a new clinical instructor. Who's to determine this here?
Non-applicable, that's going to be determined by the clinical instructor. The challenging thing is because our students go to all different sites and this different types of clinical sites like outpatient, inpatient, rehab type of settings, home health, that not everything on this assessment tool can be observed in every clinical site. And we realize that. And we have, we're all accepting of that because we can't send our students all to the same place. And they may not have somebody coming in who needs mechanical lumbar traction, or they may not have that equipment in their facility.
Okay.
And if that's the case, then it is completely appropriate for the clinical instructor to put non-applicable.
So even though you're my supervisor, I still have the authority to determine if something's not applicable.
That's right. And
Okay.
we just deduct that from the points at the end so it doesn't penalize the student.
Okay.
Non-observed would be that maybe they have that opportunity available within their facility, but they have not had any clientele or any patients come in with that they could utilize the student for to do an assessment. An example of that would be wound care. If we had a patient, if we had a situation where we had a student need to be checked off on wound care, but the facility never had a patient come in with a wound, we could not observe him in that situation. And that's something that can't be mimicked. You know, we can mimic setting each other up on traction or doing ultrasound, but we really can't mimic a wound.
Okay. Okay. Cool. That makes sense. I appreciate that too.
Sure.
One more thing I think we need to go over, and we had mentioned this before. Well, there are actually two more things, but we need to kind of maybe go over this. This might be more important. We had spoken about the difference between safety and behavioral criteria. Did we do that yet in this webinar?
Yeah. Yes, we did.
We
The
did.
difference between accountability versus looking at the plan of care. Yeah.
So we've gone over that. The safety versus behavioral?
Yes, I think we covered that. The single asterisk versus the double asterisk.
Okay, that's the difference between safety. Okay, yes, we did. All right. See, I am really I'm brand new. Good, good. Well, I think that the next part of it that we need to go over is the notion that there's a self-evaluation portion. But when I look at this document, I don't see the self-evaluation portion. So where is it?
Well, that's correct, Sean. The student actually does the exact same tool on their self. So the clinical instructor's tool that the clinical instructor is utilizing to grade the student actually has a copy that they do the same thing on their self. Our
Really?
hopes is at midterm that the clinical instructor and the student sit down and they look at their tools together. And from that, the student and the clinical instructor tools are usually pretty much right on. There may be an area that one has higher rated and one has lower rated, but this is a great time to open up communication. Because, for example, if the student marks theirself as a 4 of always going and reviewing the plan of care at midterm, and the CI marks theirself as a 3, the student may say, well, I do that every time right after the evaluation. And then the clinical instructor may say, yes, but you may need to look at that chart to make sure that nothing's changed, you know, in the orders in an acute care setting before every session, not just before every at the end of the evaluation, just to make sure that nothing's changed on the patient's acuity. And so that type of communication done at midterm between the CI and the student, then the little light should go off in the student's head of going, oh, I see how that's being interpreted. I see my area of weaknesses.
Okay, okay. Now, let me ask one more question to follow up on this one. They're supposed to earn a 4, I guess, on the final, right? The midterm, if they have a 3 at midterm, it's okay. If they don't earn a 4 in the final, then there's a problem.
That's right. They will not pass this clinical affiliation if on the single or the double asterisk they do not have a 4, regardless of their overall score, and they will not pass if they don't have an average score of a 3.
So it's really important that I have a conference with my students who I believe earn a 3 in the midterm.
That's correct.
Okay.
And it should be being done at midterm, yes.
Okay. And I can also talk to them, you know, if I see after a week that it's going to be a 3, I could always talk to them.
Yep.
Okay, okay.
Yeah.
Great, great. Is there anything else that we need to go over? I know that we mentioned at some point before we started, you wanted to reiterate that I need to sign something.
Yes.
And is that...
At midterm and final, the clinical instructor and the student both need to sign each other's assessment. So this is a clinical instructor's assessment. The student signs it, validating that the CI went over it with them, that they reviewed it, and then the CI signs it. The CI is also supposed to sign the student's self-assessment.
Okay.
That way that we know that the student actually went over their self-assessment with their CI.
Am I supposed to set up some time before we begin our... are they called rotations?
Yes, they are.
Go ahead. Clinical
Yes, they are
rotations?
called
Okay.
clinical rotations. If I'm answering your question correctly, Sean, it's up to each individual site of how they do that. Some sites will take advantage of doing this over a lunch hour. They may do it at the end of the day or the beginning of the day at midterm and final. Some sites will wait until they have a cancellation, but they know they have a day of the week that they're probably going to shoot to trying to get this reviewed with the student.
Okay. Okay. You know, I'm going to step out of my role as an adjunct instructor, a new CI, and
Hmm.
back into my role as a faculty development director. And and correct me if you think I'm wrong, but I would advise instructors to do their midterm evaluation or assessment after the day is complete, especially if there's a potential that the student is going to disagree with your assessment. Because you know as well as I do, students, when they get back bad grades, whether it's on an exam or something like this, that could put them in a bad mood.
Hmm.
And so my advice might be to wait until after, if possible, if time allows, do this sit down after your day is over.
Hmm.
That's what I
And
would do.
yeah, I hear that, Sean. The only thing is that with that, that also goes back to those professional double asterisk behavior that sometimes patients put us in a bad mood. You know, sometimes we get feedback or things aren't going well, and as a clinician, we need to be able to bounce back out of that pretty quick.
Okay. So it's
And so
part of their
yeah,
training.
it's part of their training. It does show, you know what, just because something, you know, you didn't get the best review you want, or, you know, there may be some areas that you need to work on, somebody's pointed out your weaknesses, you still need to put the patient first
That's a good point.
when you walk out the door. So, you
Good
know,
point.
yeah, yeah. I think, Sean, we still need to look at the overall grading of
Hmm.
this tool, like how they come up with the final
Yeah.
grade.
Where should I go for that?
All the way, I think it's the second to last page. Yeah,
Here?
right there where it says total points. So what the clinical instructor will do is they will total up all their points on each through the midterm column or through the final column that they have. So it would be like 3 plus 3, you know, plus 4, whatever.
Hmm.
Then they divide it by the total number of items they scored. Now, if they marked, there's 67 items to potentially be scored, but some of those may be non-applicable or non-observed. And so then they have to take those out to give them the average overall score for this affiliation. 3 is required for this affiliation, and so if we just divide a 3 by 4, that's 75%. So that the lowest they can get is the 75% to pass this clinical affiliation, which is a 3.
Okay.
Our grading scale is outlined in the syllabus. I believe they have to have a 91 to get an A, and it kind of breaks it down from there as far as percent-wise. But that's how we use this in an academic setting, is that a 3 really correlates over to 75%.
Great. Okay. Awesome. What else do we need to do?
The final page on this, Sean, if you go down to that, because this sometimes does end up being a little confusion on here, and just to make sure that we highlight that, this is just kind of an overall page where we want this clinical instructor to make sure that they tell the students what their strengths are, but also their weakness. The first question is just a general question, because what we want to do is get a gut feeling from the clinical instructor overall where they compare a student to an entry-level PTA. An entry-level PTA we define as somebody who's graduated, who's getting ready to walk out the door, take their boards, and go, and that would be a 10. We know our students are not that on their first and second affiliation, so, you know, we expect them to be 3s. We expect them to be 6s, you know, that they're not there, but it kind of gives us just an overall feedback of where the student is. Then the next question is good feedback for us is, are they performing? You know, do you think that they're satisfactory for this affiliation? And it's also a check for you as a clinical instructor, because if you put no, that means you really should be making sure that you're picking up the phone and calling me as an academic coordinator, so we can kind of come up with a remediation plan for this student to see if it's possible to have this student pass clinical affiliation. And so that's really just a little nice indicator for you.
Okay.
Overall, then, it just kind of discussed the student's strengths, and then the last one is discussing the areas that they need to be improved upon. It gives them feedback for the future, for their next affiliation, that when they're going to their next one, what they need to do. or what their area of strengths are, kind of helps them from a goal perspective of, what area they may be leaning toward as a clinician. The student also fills this page out on their self, and that sometimes is confusion because the students goes, oh, I have to do that. It's very important for the students to identify their strengths and weaknesses because we think that that shows accountability when they realize that, what, they may be great at doing modalities at this point in time, but they're not very good at progressing exercises. And because of that, then they need to come up with an action plan for their self of how they're going to improve.
Yeah, definitely. That accountability and self-awareness.
Mm-hmm.
And you can't improve. Yeah, you can't improve if you don't know what you need to improve upon yourself. That's good. Okay. I think I had a question. Yeah, I do have a question for you. Mm-hmm. Now, you had mentioned before that the student, of course, sees my evaluation, all the scores up here, right? The previous page is now, and we're on down to page 7. Do they see this too, or does this go just to you?
Yes. Nope, they see that.
Okay.
We don't hide anything from them. They are. This is meant to help them as a clinician because we all have strengths and weaknesses. And what we then do is we want them to become self-aware. Where they're at, because it's very important that we know not only our strengths but our weaknesses, because that sometimes limits us to saying we can do certain procedures when we're not competent in them.
Okay. That makes sense. I like that. Let me ask you one more question before we sign off.
Sure.
There's one of the things that we wanted to do was talk about the differences between the 234 assessment tool and the 253 assessment tool. This is the 253. What's the difference? And I was looking at this before. Doesn't seem like there's a lot of difference, but you said that there is some. What do we need to talk about?
Yeah, go down to the second page, Sean, and I can show you the biggest difference between them.
Okay.
Keep going down, just right under interventions, if you would, for me. That's probably the best.
This is 253. Let me go back to 234, and I'll go to the second page there as well.
It may be the third page, Sean.
Okay, here's interventions here, right?
Yeah, go down to the third page for me. There I can show you the biggest difference.
Okay.
Okay, right here.
This is 234.
Yep, right here. It's really based off what they've had in their academic setting before we get there, because we can't expect a student to be graded on something that we have not given them academic knowledge on. So for example, you'll see that for 234 they've performed ultrasound. They've had ultrasound training. They've had modalities. But we separate out electrotherapy from ultrasound. So they're not going to have knowledge of what a TENS unit is or electrical stim. They just won't have knowledge in it. Now that does not mean that the clinical instructor cannot have them perform that in the clinic. If the clinical instructor goes over it with the student, teaches the student how to set up the machine. We're not saying that it can't be done in a clinical setting. What we're telling you is by putting non-applicable is it's not fair for us to have you grade them on it because they have not had the academic training.
I got you.
Yeah.
I got you.
So that's the biggest difference. It's really based off where they're at. So you're right. The tools are exactly the same. The difference is for 234 there are less items to score the student on.
Yeah, 253 doesn't have the NAs next to it. I see what you mean.
That's correct. Yeah. But then they've had majority of their clinical academic training.
Anything else that's a difference?
No, that is really truly the biggest difference. It's based off their academic training. The only other thing I would tell you is mostly for 234 is that we're expecting the student to be able to perform interventions. They've had training to be able to do things, to follow directions. 253 is where we want them to start to do more critical thinking. So you'll see the differences if you go to the fourth page there, Sean. I believe it's on the fourth page. Is you'll see that now you're starting to see the term for 253 is they should be able to progress. I think like 37 is an example of that. We not only are expecting them to take a patient through a plan of gait training that the PTA or the physical therapist has established, which they could do in 234, but in 253 we'd expect them to start to gain some knowledge of saying, okay, this is what we've currently been doing. How can I progress this for the next treatment?
Ah, that's right. There's more NA here. Okay.
That's right. Yeah.
And then 253 doesn't. Okay. Well, that's a lot. That really helps me, especially if I ever decide to become a physical therapy assistant
you never know.
in CI. All right, nice. Well, thank you so much. Anything that you want to conclude with?
I thank you very much for your time today. We appreciate your knowledge. We hope that this has been helpful in understanding the educational methodology, the tool that we use at or Georgetown Technical College. Sometimes terms that we use in the academic world are not always that familiar to everybody in the clinical world, so we hope this clarifies. And any other questions you have, feel free to give me a call. I can be reached at 843-477-2067.
Wow. Thank you so much, Tammy. Appreciate it. And we'll stop here. And thank you so much from me, too, as I can try to help adjunct instructors. This is something that I definitely don't have to worry about because you've got it all. Thanks so much.